regardless of one's political beliefs, we can all applaud what the world witnessed yesterday as they saw a peaceful transfer of power from one administration to the next. Y'all, that's what separates our country from a lot of countries around the world. Now I remain committed to working for the people of Alabama, and we'll work in good faith with the new administration. We've got a lot of big issues to tackle, and we need to find ways to work together to solve those problems and situations. One item that is not Republican or Democrat, but is an American issue, is working together to defeat COVID-19. Along with Dr. Harris, we're here to provide an update on our current health order and to update you on the vaccine rollout. Our current health order expires tomorrow, January 22nd. A great many of us had hoped that when we began the new year, we no longer have to incorporate things like face masks and social distancing in our daily lives. But after the Christmas and New Year's holidays, COVID-19 numbers and the number of hospitalizations were higher than ever, more than our highest point from last summer. At one point last week, of the 1,600 ICU beds in our state, 1,561 were occupied. Folks, that means that only 39 ICU beds were available for COVID-19 or cancer patients or folks involved in severe accidents. As of Wednesday, our 7-day average for the new COVID-19 cases was 2,666 per day. That's far below the spike in cases recorded earlier this month following Christmas, but way above averages recorded 2, 3, and even 4 months ago. With that news, it shouldn't come as a surprise that Dr. Harris and I are here today to extend the current order with no changes for another 6 weeks until March 5th. The mask mandate remains the one step that we can all take in order to keep some balance in our daily lives and stay healthy and safe. Quite frankly, we've run out of ways to underscore the importance of taking this virus seriously. And ironically, it's not very complicated. Wear your mask, wash your hands, sanitize the places where you are. And if you're experiencing symptoms, please go get tested and wait until you receive the results before you interact with others. Even as we continue practicing personal responsibility, y'all, I want to also urge patience. As everyone knows, the vaccine rollout has begun, and Dr. Harris and his team at DPHF are working around the clock to get shots in arms. And I'd like to personally thank the staff of ADPH who work 7 days a week diligently, and they've received no public acknowledgement. On January the 8th, we announced that in addition to our medical professionals and our residents in nursing homes and assisted living facilities who are currently eligible to receive the vaccine, our first responders and people 75 years of age or older would also be eligible. Unfortunately, we simply do not have enough vaccine for everyone who wants one. In fact, no state does. However, the team from ADPH is working diligently to distribute our vaccine statewide. The latest locations can be found on the ADPH website with contact information to the providers in your local communities. Do not call if you're not eligible. And if you are seeking a vaccination from a private provider, you'll need to call them directly. As Dr. Harris makes his way up to the microphone, I'd like to once again thank the people of Alabama. Thank you for keeping on, and being willing to take the vaccine, we'll get through this thing together.